Hello and welcome to another episode of the Business and Experts Forum. I'd like to welcome you, and especially if you are first to this program, a very special welcome to you. Business and Experts Forum is basically a platform for developing people and businesses through knowledge sharing. What we do is that we highlight the progress and achievements made by people willing to go the extra mile to improve their lifestyles and the lifestyles of those around them. And we do this by discussing some of their strategies and approaches that they have adopted. And we do that by bringing specialists and experts in their respective fields who come in to share knowledge with us on topical issues such as technology, finance, medicine, engineering, entertainment, social media, the law, just to name a few. So if you're someone who wants to go either into business to improve your business processes or gain knowledge, if you want to develop your passion, talent, or hobby into a business venture, then this forum is for you. We are live every 2 weeks on Mondays at 7 p.m. GMT, 2 p.m. Eastern Time if you are joining us from the USA. And please remember to subscribe to the channel and click on the bell to receive any notifications for every episode. Right, tonight we are focused on first aid in the home and what to do in the event of an accident before the paramedic or doctor arrives. Statistics published by the Royal Society for Prevention of Accidents reveal that there are approximately 6,000 deaths a year as a result of home accidents. Recently, a lot of us have been spending a lot of time at home, either working or forced to stay at home as a result of the pandemic. And as a result of that, we have become very prone to accidents in the home. So, what do you do when there is an accident in the home? You're not a paramedic, you're not a nurse or a doctor. How do you act to save your loved ones and yourself? To discuss some of the quick and easy first aid techniques in the home environment, we have with us tonight Mrs. Rosie Osuachow, a fully qualified VR registered physician associate with over 4 years practice experience. She studied BSc in biomedical sciences, went on to do a postgraduate degree in physician associate studies, and has been practicing for 4 years. Ladies and gentlemen, please welcome Mrs. Rosie Osuachow to the Business and Access Forum.
Hi, everyone. Thanks for having me today.
Hello, Rosie. You are welcome.
Thank you. Thank you for having me. It's
Good.
my first time on this platform. I'm very excited.
Okay, good. I must say to our audience that Rosie seems to be having some problems with her internet. So just in case she freezes, we'll just give her a bit of time to come back in. So just in case she freezes, please bear with us. We'll bring her straight back in. But at least for now, we can hear Rosie and we can see her. So that's a good thing. So Rosie, let's go straight to the point. I mean, according to medical research,
Yeah.
we have a number of accidents around the home. There are some top ones. The top ones include things like choking,
Yeah.
objects in the ears or
Yeah.
nose, head injury, minor
Yeah.
burns and scalps, slips and fall,
Yeah.
cuts and grazes, results in bleeding, and poisoning. Let me start one at a time. Let's start with choking. And we know that, I mean, this is a very common thing. If it happens to
Yeah.
both adults and children, I mean, as adults, you
Yeah.
can choke on simple things like popcorn,
Mm-hmm.
and with children, it's so rampant. How do we deal with that? First of all, what causes it? How can we prevent it? And if it
Okay.
happens, how do we deal with it?
Okay. So again, thank you for having me. Just to say, this is not a your substitute for basic life training. So if you listen to this forum, I also encourage you, if possible, if any training comes up for you to do basic life training, please by all means do take it. So choking, as you said, is one of the most common things, especially in kids. It will amaze you how frequent and how rampant it is. Kids can pick up anything off the floor, from simple grapes to popcorn, as you said. It goes into the mouth. Simply adults, and they can choke on it. So when that happens, you're looking for signs of choking. So whenever you see that a child is distressed, they're coughing, they look, they're flashing around the face, they can't talk, they're crying, they look distressed. You want to find out what has just happened. Have they popped something in their mouth that they can't get out? Is that the reason why they're behaving the way they are? And if one of the good signs actually of choking, if I may put it that way, is a child that's coughing. If they're
Okay.
coughing, perfect. You don't need to do anything. Just encourage
Right.
them to keep coughing it out, because it means
Mhm.
that their respiratory system is still intact, it's not blocked. So just encourage them, cough it out, cough it out. Now, what you want to watch out or look out for is if they're not coughing, are they
Okay.
struggling to breathe? Yeah, are they struggling to breathe?
Yes.
So you want to think, are they struggling? Is this child struggling to breathe? Did they look like they're choking? Did they look like they're about to die? With a
Okay.
child that's coughing, if it's a baby, so there are two different things to do for a child, a baby. Children and adults are in a bracket. You can put them in one bracket. A baby, because they're quite young and more fragile, you put them in a separate bracket with what to do. So I think I put some PowerPoint up so we can get the picture up, just to give the audience a fair idea of how to position a baby that's choking. So if
Mhm.
you look at the picture that's on my right, what the mum is doing is, so she's positioned the baby on her lap, supported the
Yes.
head with one side of the hand, and then what you want to do is administer what we call blowbacks with the heel of your palm. You want to give 5 blowbacks to the back. So this is if the child is not coughing. If the
Right.
child is coughing, we encourage them to cough. That's a good
Yes.
sign. If they're
Okay.
not coughing, you want to start with what we call the blowbacks with the heel of your palm, gently in between the shoulder blades. You want to administer 5 blowbacks to the back. Now, with
Mm.
each one you give, you want to check, have whatever that's lodged in the throat, have they coughed it out? If they've coughed it out, there's no need to continue doing it, because you're going to
Right.
end up causing more harm than good. After the 5 blowbacks, again, you want to check, are they still do they still look distressed? Has it not come out? If it hasn't come out, you want to move on to what we call chest thrust. So you want to flip the child over in between the armpit, just in the middle bit. So just use the armpit as a marking point in between,
Right.
in the middle of the chest, and then
Yes.
you want to try and deliver what we call chest thrust. You want to again give 5 of those. So that's for a baby that is choking. Again, I reiterate, if they are coughing, encourage them to cough. You don't need to do any of the things that we've discussed, or any of the things that we've mentioned. Now,
Okay.
as I said, with babies, because they're fragile, you put them in a separate bracket, because you have to be
Right.
careful with them, as opposed to a child or an adult,
Adolescents. Yes. Yeah.
adolescent. Now, with a child and adolescent, they can stand up. What you want to do is support them from the front, let them lean forward, and the same. You want to give the back blows as well. Same 5 back blows with each attempt. You want to check,
Yes.
has whatever that's lodged in the throat, have they coughed it out? Is it still there? If after the back blows still not come out, then we do what we call abdominal thrust. So you want
Right.
to put your hand in between, you want to wrap yourself around them, and then just push up from the belly, or from the abdomen, to cause
Yes.
them to bring out whatever that's lodged there. Now, this is someone who is conscious. If at any point they become unconscious, they stop breathing, after delivering the 5 back blows, and going back to the child, delivering the 5 back blows and 5 chest thrusts, if it hasn't come out, at that point, you need to call 999 and explain to
Right.
them what has happened, because you're
Okay.
not sure, this thing isn't coming out. Is this person going to go into a cardiac arrest in a moment? Are they going to stop breathing and become unresponsive in a moment? So that you need to keep that in mind as well. Back to the adult, if you keep doing it doesn't come out, let's assume that they've become unconscious. Then we want to go into what we call your ABCD approach. So one, you want to, let me not take you too far, because I think we will touch up on one of the
Okay.
slides. So feel
Okay.
free to interrupt me if I'm talking
Okay.
too much. I
So
feel
so
like
I
I'm
was
at
gonna
work.
I think it's very good from I like the
Mhm,
fact that you separated the children from the adults. And I think that we just to make it very clear. I mean, this
mhm,
is very serious because
mhm,
children can. I mean, as much as you can as a parent, you want to keep
mhm.
an eye on your children all the time,
Yeah,
but
yeah,
it's impossible. So you're
yes,
going to have children who pick up things that you don't see, and then they will put it in their
yes,
mouth, and then okay. So it's important that people understand how to approach this, especially for those who have got babies. It's very important
yeah,
because this is actually a lifesaver. Now, when it comes to
it
the
is.
adults, you talk about the trust. Okay.
Mhm,
Now, what I want to find out is, I know we talked about the heel, the hand
yeah,
heel or whatever
yeah,
it is, 5 times. So
yeah.
if it's a series of fives, how many series of five do you do? Do you just do five and then you check the mouth. There is nothing in the mouth. You do it again. How many times do you do it before you call 999?
So you want to do it ideally. You want to do it twice before you call nine
Okay.
nine nine. If you've done it, if 999 has been called, then you carry on doing it until whatever that's dodged is comes out, or until they become unconscious or they stop breathing.
Okay.
Then again, that's a separate thing that we're going to go into. Um,
Right.
Ideally, that's one thing you want to be mindful of. As I said, you don't want to do it 10, 15 times and then realize that this is not going anywhere, because the more you're doing it, the more you're causing distress as well. So that's
That's
one thing
fine. Yes.
you have to bear in mind. Yeah.
Okay. Okay. Now with the adult, it's
Hmm.
important to make it very clear that you put your arms around them. And
Hmm.
now what you do is that you put your hand in a kind of
Intertwine. Yeah.
a twine
Yeah.
under they are just under their lungs,
Yeah.
above between their belly button and their lungs. And what you do is you squeeze them. You have to stand behind them, right?
Yeah.
You need to stand
Yeah.
behind
You
them.
need to stand
Put your arm
behind them.
around.
Yeah.
You need to stand
Yeah.
behind them,
Yeah.
hold them, and then you push in. You do the thrust 5 times. Is it the same thing? Five
Five
times?
times the same.
Five
Yeah.
times. In the same way you
What
do
we call
5 times, and then
abdominal thrust. Yeah.
a couple of
Yeah.
wives, fives. If there is no response, then you have to resort to 999.
I think that's one thing you have to bear in mind is, whilst you're doing this, obviously you don't want to you don't want to end up causing more damage, and you have to
Right.
be mindful of yourself as well. So let's assume it's a very heavy person that you simply
Right.
can't get your arm around, and you can't do
Right.
it. It doesn't make sense for you to try and do it, because you're going to be worn out, you're going to be tired, and you're not going to achieve much. If there is
Right.
someone around that can help, enlist that help. If there isn't, then
Right.
obviously call 999 as soon as possible, because the aim is to try and get help. The aim isn't for you to try and be a hero, if I may put it that way,
Right.
and doing
Right.
something that's going to end up compromising you or putting yourself in danger as well. So that's one thing
Okay.
to be mindful of. Yeah.
Okay, so just to run up on the choking, because there are a number of things we want to talk about, a number of
Yeah.
accidents that happen in the home. We want to talk through them as much as possible. So I just looked up some statistics, and in the
Hmm.
UK, it says that about 300 people die every year from choking, and
Yeah.
85% of the deaths are caused by food. Now,
Yeah.
in terms of food, people think that the things that can choke you maybe will be popcorn or nuts, but
Yeah.
in actual fact, you can do things like large chunks of meat, large
Yes.
chunks of meat that are difficult to chew. So
Yes.
if you buy what we call cow food or stuff like that, you got to be careful, because those are some of them are very hard to chew. They're difficult to
It
chew,
is.
and they are large. They come in large chunks.
And
Okay,
in
now it
restaurants as well, that's you to more of that actually.
yes, yeah, okay.
Yeah.
There is also thing about hot dogs and grapes. You know, these are things that we normally we buy, we eat all the time. Grapes can choke hot dogs, and so how do you prevent that? So I know there's always something about don't eat and talk at the same time.
Hmm.
Now, can you quickly explain before we move on to the next thing how that eating and talking can result in choking without being too scientific or being too medical? Oh, I hope you haven't lost Rosie. No way. Okay. Rosie's frozen. As I said at the beginning, she seems to be having problems with her broadband. So we will try and get Rosie back as much as possible. Whilst we are waiting for Rosie, I want to show you this book for the audience out there, 1001 Home Remedies. If you can get it on eBay or Amazon, please try and get it. It has a lot of information on a lot of things that we are talking about here. It has, I mean, what so many in terms of the kind of ailments that you possibly could have and how you can deal with them from the home. It starts from allergies, acne, through what fever, food poisoning, food odor, kidney stones. These are things that we you experience, and these are there are ways in this book that can help you. You can basically before the doctor comes in, things that you can do. It's a book that is how many pages? It's over 400 pages, and there are things about some of the healing attributes or some of things like tea and all of that. So we're waiting for Rosie to come in. Just for those who have just joined us, we have tonight Mrs. Rosie Usu Achan, who is a registered physician associate. She's more like a doctor. She's talking to us about some of the accidents, common home accidents, and how you can deal with them. We've just been talking about choking, and we're going to be talking soon about things like when you have objects in the ear, head injury, minor burns and scalps, slips and falls. We're going to talk about cuts and grazes that will lead to bleeding. We also talk about food poisoning. I hope that we can get Roses back because there's a lot of information for us to go through tonight, and I'm just hoping that she'll be back. Whilst we're waiting for her, for those who were not with us at the last episode, we talked about mindset revolution. We talked about how you can change your mindset, how you can change your thinking, just to be sure that you focus on the positives of things, and you got to try and push out the negatives from your mind, just to help you, progress, because it's very important that you have a positive mindset whenever you are doing things. A lot of the time, your mindset, and there is this saying that it's the mind that controls the body. So if you have good thinking, you're thinking about the right things, and you're thinking about some things, positive things, then your body is likely to move in a positive direction. But obviously, if you're negative, then it brings in fear and all the other things that don't help. Okay, we have Rosie. Rosie is back. Okay. Um, Rosie, can you hear me?
Can you hear me? Can you hear me, everyone? Apologies,
Yes,
everyone.
yes. Okay, that's
Yeah.
fine. It's good that you are back. So let's move on to objects in the ears.
Okay.
Okay. So talk to us. We know with children are they are wonderful, but
Mhm.
children can get you into trouble. They pick up stuff, they try things, they are always adventurous, they want to see what's happening with things.
Yeah.
I mean, when
Yeah.
we had our daughter, at the point, she actually, one of my first daughter, she swallowed her earring and came home from school and told the mom, "Oh mom, I swallowed my earring." Nicely. She was laughing. "Oh mom, I'm swallowed my earring." "What? You swallowed what? The earring?" "Oh yeah, yeah, I put it in my mouth." "Tell me what happened." "Oh, I put it in my mouth and I just swallowed and it's gone." "Really?" Things like that. So tell
Okay.
us about things in children's ears. What causes it, and
Okay.
how do you
Okay.
help? How do you help a child who's put something in your ear?
Okay. So this is something that I actually encountered a lot during my accident and emergency training when I was at uni. You see a lot of parents coming in very frantic and upset and worried, and rightfully so, because a child has put toys. Toys is one of the most common things that kids tend to lodge in
Right.
their ears, and these toys that you buy from the shops at Argos, they've got these little bits and pieces that come with it. Kids are very, what's the word, it goes in any hole opening that they can find, nose, mouth, ears,
Yeah.
any opening that they find, they will put something in there. So one thing for parents to be mindful of is toys, little or toys that's got little pieces with it.
This is
Now
yes.
if a child puts something, if they swallow something like an earring, as you've said, the good thing about the bowels is what goes in this way will come out the other way.
Yes.
So in that sense, it's not so bad. I mean, no
Yeah.
one is going to go inside and take it out. The ear, on the other hand, is different. So when they lodge something in the ear, they they're going to start complaining about pain, difficulty hearing. We're worried about infection as well. We're worried about perforation as well of
Right.
your inner ear membrane.
Yeah.
If you think a child has put something in the ear, please don't try and take it out. I think that's one thing that I always tell parents whenever I get a phone call or
Okay.
whenever when I'm at work and a parent calls me or they've put something in the ear. Do not try and take it out. Take them straight to urgent care. Take them straight to A&E. If it's a fly, it's different. So flies, because they can float, you can actually float them out.
How do
Let's
you
assume
what do you flow them out?
so let's assume a child has put a fly or has flown into you've gone out into the park, an insect, a fly has flown into the right ear. What you
Yeah.
need to do is just tilt them over slightly on the
Okay.
opposite ear. Use a bit of warm water, put it in
Okay.
the ear where the fly has gone into,
Yes.
and then as the water goes in, it will cause the fly to flow out. And
Okay.
then you can just tilt them slightly, and then the fly can come out.
Right.
Yeah, if you
Right.
feel brave enough to do it, then by all means. But still, if you're concerned, if you're worried, especially if they complain about pain, if they will be very distressed because they're kids. So, and naturally, as a mom, you'll be distressed as well. If you're concerned about any signs of an infection, any swelling behind the ear, you're very worried. They've got a fever, generally not well. I encourage you, please take them to urgent care or A&E. If not,
Okay.
with things in the ear, I think the main thing to take home is don't try to take it out. Take them straight
Right.
to urgent care, your nearest A&E. If it's a fly, you can try and float it out.
Okay, so let's go back to the fly bit. So
Hmm.
if it's a fly in the park, and
Hmm.
this happens in a lot in the park, because when you go to
Yeah,
the park, because of the greenery, you have a lot of insects floating about,
yeah.
and it goes in the ear, and you don't have warm water. What do? You don't have water. You don't have warm water. But the fly is
So
going in the ear. What do you do?
the fly is going in the ear, so you can't put anything else in there. I advise you to take them to your nearest urgent care. So they should call. So in case if you're worried, if you have any concerns, call 111. They can always advise about your nearest urgent care, about the nearest place to take them. Don't try to put anything else apart from water in there, because then that in
Okay.
itself becomes problematic as well.
Okay. What could be the potential problem with that if you have a fly in the ear for the child?
Oh, so infection. So the child is going to be very irritated
Okay.
anyway. If the fly is alive, it's going to be
Oh no.
tugging on the
Okay.
ear, the shin, and signs of middle ear perforation as well. If
Right.
that becomes the case, with middle ear perforation, the good thing about, because we see that a lot, the good thing about it is it can repair itself, or it does repair
Mm-hmm.
itself. But then we're also worried about the risk of infection. So if that becomes the case, again, please try and seek medical advice as soon as possible. Call 111. If they're very unwell, take them straight to A&E or urgent care.
When you talk about middle ear, are we talking? Can you see what we call the eardrum?
That's correct. So yeah,
Okay.
that's your
So what
eardrum.
what
That's
we
your
what we
tympanic
know as
membrane.
the eardrum is what you are
It's,
calling the
it's
middle ear.
your
So that
tympanic membrane. Yeah,
exactly
yeah,
that can
yeah,
be infected.
yeah.
Okay, so just for those who have just joined us, we've got Mrs. Rosie, also a child who is a registered um, physician associate
Hmm.
and has worked in the GP practice for over 4 years now. She's here talking to us about some of the common accidents that happen in the home and how you can
Yeah.
deal with it. And these accidents can happen to either you
Hmm.
as a parent, or even as happen
As an
to your
adult, yeah,
an adult, or it can happen to
yeah.
a child. So it's important. Please, if you have any questions, please put them in the chat, and then we'll try and go through as many questions as possible. And please, if by any chance you're unable to ask your questions and you still have more questions after the program, remember you can get us on business and expert forum at gmail.com, business and expert forum at gmail.com. Okay, Rose. So, Rosie, let's go to head injury.
Okay.
That's another thing that we have in the home. I mean, this
Yes.
pandemic has made us realize a lot of things. One of the things we
Hmm.
realize is when you have children at home, especially for those of us who live in Europe or in America,
Hmm.
most of the time the children are spending time in the home.
Hmm.
So they run around. The boys, especially, they want a lot of space to run around. They run around. They do all kinds of things. They can fall down the stairs. They can hurt themselves in
Hmm.
so many ways. If you have a case like that, a child is falling down and you suspect head injury, what do you need to
Hmm.
do?
So two so there are two types of head injuries. One, is it a minor head injury or is it a major head injury? If you're let's start with the minor head injury. So minor head injuries is the one that most parents tend to see a lot at home. As you said, running around, they'll bump the head on the fridge or bump the head on the side of the table, or they will trip and then hit them their heads, or whatever the case is or the scenario is. If it's a minor head injury, so you're going to see a bump, you're going to see a swelling. Sometimes it can be quite prominent, and as a mother, you will be concerned. You see a huge bump protruding
Yeah.
on their forehead. You think, oh, what is this? What's going to happen to them? Are they going to pass out? Are they going to be unconscious? Normally, with minor head injuries, they're very common. They don't lead to concussion, and most of the time, you don't need to do much about it.
Right.
Obviously, they might develop a little headache from it, and with that, you can just give them ibuprofen. You can give them paracetamol. If a child fall down, bumps their head, sit them up first and foremost. Sit them on your lap if you have to, and try to
Right.
console them, because you need them to be calm. That's the first thing. If you have an ice pack at home, or a bag of peas, or bag of vegetables, wrap it in a tea towel, and then just put it on wherever they bumped, whichever side of the head that they bumped. Put it there for a good 10 minutes. So you
Right.
want to try and reduce any if the swelling, it will reduce the swelling there. If there's any inflammation, it will help the inflammation go down. I think that's one of the main things, that parents become frightened when they see a bump, or they see a
Right.
cut
Okay.
or anything of that sort.
Hmm.
If it's a cut, try and keep it clean. So put a flannel in warm water, clean around it. Don't try, if an item is lodged there, do not try to remove it. So I think that's
Okay.
another take on point. If a child falls down, an item, a piece of glass, whatever is lodged there, do not try to take it out. If they're
Right.
bleeding, yeah, perfect. Thank you for that picture. So put a bit of the ice pack, as the mother is doing, over the head. Keep it there for 10 minutes and just check for consciousness. I think that's another important thing. So with first aid, um, one thing that you have to be mindful of, one thing that you have to do is check for consciousness. So, one, are they
Right.
alert? So, if a child is alert, they're responding, they're crying, they're moving about, you know they're alert. One, they're not alert, are they responding to voice? Or they're not responding to voice, are they responding to pain? Or they're not responding to pain, they're unresponsive. So, with each of these, there are things that you need to do.
Right.
But the main thing is they bump their head, they're crying, they are alert, you're not concerned about anything, they have a mild swelling. Just put a bit of ice pack or frozen bag of peas or vegetable, whatever you have, then just keep it there for 10 minutes and just console them. And if, as I said, with minor head injuries, they may develop a few headaches. If you have any concerns, always call your GP and discuss with them. A bit of
Okay.
simple analgesia or ibuprofen, paracetamol, normally over the counter is what we recommend, just to calm them down if they develop anything. Now, with major head injury, or if you
Right.
suspect a major head injury, that's different. And what are the signs of a major head injury? So the person has, normally you see that in car accidents, or if there's been a major trauma, um, the person is, well, they're responsive, but they complain about dizziness.
Right.
They're vomiting. They're not responding to you. They look very confused, or signs of confusion. They're unwell. We're worried about a bleed. So this person needs to take into hospital as soon as
Right.
possible. If they have fallen down, don't try to sit them up, because if they've had a major head injury, you're also worried about spinal injury as well. So
Right.
don't try to sit them up. Leave them flat on their back or whichever position they're lying in. Try and talk to them, try and keep them calm, try to reassure them, try and keep them alert as well.
Right.
And then call for help as soon as possible. You want to call 999. Explain to them what has happened, explain to them what you suspect as well. Because I think most of the time it's communication. The information you give to the call handler on the opposite
Yes.
end will help them determine or judge how critical or how serious the issue is. If you tell them, oh, is anything serious, they're going to go on your word. So based on
Right.
what you're seeing, based on how the person is responding to you, just hand over, explain exactly what you think or explain what has happened first and foremost, or what you suspect you think the case it is.
Right.
If you think you.
Okay. Okay, so I just to recap quickly,
Mhm,
because we'll move on to the next thing. So it's important if it's
mhm.
just a minor one, that put that ice pack on the head for 10 minutes, and then give
Yeah.
them paracetamol after that.
Mhm.
If it is something embedded in their head, don't remove it, because that could be
Don't
the
try
one,
to
the thing that is preventing the bleeding. We come to
bleed
bleeding
it.
shortly.
Yeah.
It's
Yeah.
preventing bleeding, so you don't need to
Yeah.
pull it out, otherwise it may bleed to death. Now,
Yes.
if it's a major, well, especially if they're falling down, don't lift them up, because it could be a case of injury in the
Yeah.
spine. So you want to be sure that they are safe before you
Kids
lift them
fall
up.
down, or kids fall down all the time, and most of the time they
Right.
will get out of the way, so you know that this is not serious. But if it's a major trauma, it's a major trauma accident, or it's a car
Right.
accident, or they're falling from a height and you're concerned,
Yes.
don't try to lift them up, don't try to tell them to sit up. As I said,
Okay.
they could have a spinal injury, and I think
Okay.
that's addressed in falls as well.
So it's always important to call them and see how they respond, isn't it? So you have to call them,
Yes.
call their name,
Yeah.
and see whether they respond. And that could
Call
be an
their name.
indication as to, yeah, call their name and then see whether they
Hmm.
respond to you. If they are not
Hmm.
responding, that could be an indication of the seriousness of the
Hmm.
accident, right?
Well, remember what we said earlier about are they alert? Are they responding
Right.
to voice? Are they responding to pain? Are they unresponsive? So these are the main
Right.
things that you need to bear in mind. If they're not alert, are they responding to voice? If they're not responding to your voice, when you pinch them or when you rub them on
Right.
the sternum, are they responding? If not, they're unresponsive, and then you need to let the call handler know.
So it's also important that sometimes if it's a child, maybe you want to pinch them a little bit to see whether they respond to it.
Yes,
That also
yes,
helps a little bit. That
yes,
because normally they will have to respond to that stimulus when you pinch them. So if they are
yes.
not, then you know there's something probably
There's
wrong.
something serious, yeah. So I
Okay,
think CPR is very different. Not everyone is confident with CPR, and I think we
right.
advise that if you're not sure, don't do it, because you might end up causing more harm. So if you don't have the necessary training and you're not sure, and sometimes when you call 999, this is for an unresponsive person, and you're thinking, I need to do CPR. They will guide you through it, or they'll talk you. If you're not confident, don't be too hard on yourself. Wait for the professionals or someone who's trained to come on the site. And
Okay.
yeah.
Okay. So just to wrap up on the head injury, when you call 999, tell them exactly
Yeah.
what happened and what you see. Don't make
Hmm.
assumptions. that, because the little thing you leave out could be the thing that could save the life of the child. So just tell them
Mhm.
exactly what you see and tell them exactly what happened. Don't leave anything out. And just for
Just
those
say,
who are not familiar with the medical terms, can you explain what
mhm,
CPR? I know CPR is mouth-to-mouth resuscitation, isn't it? So
that's correct.
just explain just simply what CPR
Okay.
is for the audience to know.
Okay, so I was going to say something just before I forget, because I think sometimes I get a lot of 999 dispatch summaries with a parent, and the child was running around, bumped his head, and they called 999. So for minor head injuries, you don't need to call 999, just to make that
Okay.
clear. Okay, so
Okay.
if ever in doubt, for a minor head injury, call 111 will rather be the best place to call. Then they can try and get an appointment with your GP, get an appointment with me if you have concerns. If after applying the cold compress they still crying, erratic, or they start vomiting, or they become systemically unwell, then at that point you need to call 999 because you're worried about concussion. If not, most minor head injuries can be dealt with at home and you don't need to call 999 for it. Now,
Okay.
back to CPR, that's mouth to mouth resuscitation. Now, that's given to someone who is unresponsive, someone who's stopped breathing, if I may put it that way, who's
Right.
stopped breathing. So, it's to it's you're administering what we call cardiopulmonary resuscitation. You're trying to resuscitate them or get their heart rhythm back in place. Now, normally this is done by if you don't have if you don't have a defibrillator, that's the
Yes.
machine that they normally put on there to get reset the heart, if I may put it
The
that
heart.
way,
Yes.
isn't there. Then what you need to do is as I said, it's a broad topic on its own, and I will encourage you, if there is training available, to go for the training. I don't want you
Mm,
to take what I'm saying and try it next time, because this is not training. So if it's available in most workplaces. Try and go in and get the certificate so that you can do it as well. So if that's someone who is unresponsive, they're not breathing, you go there, you call their name, you shade them, they're not responding, they're not breathing, you considering I need to give them a mouth to mouth resuscitation.
okay. Okay. So that's really good. Thank you very much. So let's move on to burns and scalds. So I do have. Let's have a look. So well, burns and scalds, from what I've read, these
Mhm.
can result from hot liquids that are, and it can happen to both adults and children. And
Yeah,
in the UK, on the average, 110 children per day are seen in accident and emergency with burn injuries, and 46 as a result of hot cup of tea or
yeah.
coffee spill. So it's an important it's important that we take note of bands and scalps as well. So do you want to take us through that as well, please?
So burns, as you've rightfully said, is one of the most common things that you see. Oh, mum's left the kettle on, turn around for 1 minute, the child's pulled the extension cord, it's on them, or left a cup of tea, it's on them. Normally, if it's a minor burn, say anything less than a 50p coin. Oh, I need to double check
Right.
that. I need to double check. I think it's a 50p coin.
50p coin.
50p
That's correct.
coin.
Yes.
Anything
Yeah.
less is fine. Anything more, you need to call 999 or take them to A&E. Okay, because that's the death. It gives an indication of the death of the bird.
Okay. So just so because this program
Mhm.
is global, we have to be very clear, sure that people who are not actually based in the UK also understand what we're saying. So 50p coin, we're looking about something, a coin that is about 12 centimeters, 12 millimeters in diameter. That's what a 50p coin is. It 12? It's about 12 to 15. So that size in diameter, that's the kind of size we're looking at when it is. And also, just to say that for those who are not based in the UK, we refer to our doctors here, our GPs or general practitioners. So if you are in your country, your local country, in your country, just know the name. You can just refer to as a doctor. And if it's a 999, we will use 999 here. If it's not 999, using your country, find out what the emergency number is for your specific country and make sure you call the number. In the UK, we have two numbers. Yeah, we have two numbers. Rosie seems to have gone off now, but let me just carry on quickly because we wait for Rosie. We have two numbers. The 999 is the broad emergency number that you can use to call either the fire brigade or the medical team or the police. It's a broad thing. 111 is more specific to medical, so that's what we use. We use 111 if it's not a major thing. If it's a very major thing, you call 999 and then they ask you what your emergency is, whether it's got to do with the fire brigade or it's got to do with the police or it's got to do with medical side. Rosie, you're back. Let's talk about now. Let's carry on with the manner, bends, and scars.
Right. Okay. So if it's I think you've explained what it is for those of our international viewers as well. If it's a minor burn, it can be treated at home. So all you need to do is just take the child or the baby, the young person, and just open your cold water, your cold tap, and just put them wherever they burn. If it's the leg, the arm, let cold water run around the area or run over the area for 20
Hmm.
minutes at least. Just run
Yeah.
it there, not warm water, cold water. Don't put any ice on it. um, don't put any cream on it. That rather introduces infection. So any ice, I think sometimes you get tempted. I remember when I was younger, when I used to burn myself, they'll put Vaseline on it, and you think that's a good thing. It actually
Mm-hmm.
can it can lead to risk of infection. So if it's
Right.
a minor burn, take them to the tap, take them to the bathroom, take them to the sink, and just run cold water over it. Once you've done, take a cling film and then lengthways, just wrap it around the area of the burn, and then call your GP. Call some. I think one place that people in the community do not utilize is pharmacists. So most pharmacists have a minor ailment section, and they're actually very helpful. So they can advise on treating minor burns, minor head injuries. They can advise on topical medication, over the counter treatments that can help with things like this, antiseptics. So they're very good. So after you've done it, if it's a minor burn, you can't get through to your GP, you're very concerned, go to your nearest pharmacist, and they can advise with regards to what to do. But as the mother is doing there, just run it over the top. When you're done, put a cling film over it. And you don't need to do anything else. If you don't have water, I think this is one thing I didn't know myself. You can put a can drink over it. I normally prefer milk, but I read you can put a can drink over it as well. So put a can drink, fresh milk, run it over the area 20 minutes just to cool and soothe the area. It reduces inflammation as well. And once the risk of inflammation is reduced, automatically you're reducing the risk of infection as well.
What about somebody just put in the chat? What about aloe vera gel for burns? Should you use it? And if so, when?
You can use aloe vera gel. I think don't I, personally, I wouldn't advise putting anything on the gel immediately. Immediately it happens. What the resus what the resus group advises, just flood it with water and then put a cling film over it, because you don't want to reintroduce infection. I think we've put in aloe vera, put in cooling gels, put in
Yeah.
topical gels. The main thing we're worried about is risk of infection. Now, where you can have a minor burn, which isn't a problem, to becoming cellulitis, which can easily become a problem, and they can become septic. So cellulitis is infection of the skin,
All
and
right.
if that happens and if not treated properly or treated promptly, they can become septic. It can lead to blood infection as well. So before you do that, always get it checked out first.
Okay. The other thing that happens with burns is that sometimes you have a burn and you actually have jewelry on whilst you've had a burn.
Hmm.
Now, in some cases, yes, the jewelry can easily be removed, but in
Hmm.
other cases, the jewelry are actually firmly stuck to the
Embedded.
wound.
Yeah.
Yeah, in the wound. How do you deal with those two
So
scenarios?
if it's embedded, remember we spoke about anything that's lodged there. If it can be, so once you run water over it, if it can come off naturally, fine. What you don't want to do is forcefully pull out or remove anything that feels like it's embedded, or anything that is not coming
Okay.
out naturally.
Right.
Because the more you yank it out, whatever, you apply more pressure to the wound. You damage the wound area. You damage the place where the person has a scald or has a burn. Sometimes what we're worried about is the healing process of the skin as well. What you don't want to do is cause more damage for the skin for the skin to struggle to heal back naturally or to heal back properly, if that becomes the case. So if it's something that you can flat off, wash off, perfect. If it's something that you have to yank out, like any embedded object, I wouldn't advise that. And as I
Okay.
said, if in doubt, always seek for advice.
Okay. All right. Thank you. So, if you've just joined us, we've been talking to Mrs. Rosie Osuachan, who is a physician associate and she's been practicing as a general practitioner for over 4 years. We're talking tonight about some of the common accidents in the home and how you can deal with it. We know that a lot of us are spending a lot of time at home, and this is where you get, especially when you have children in the home, they are prone to accidents.
Mhm.
And what we want to do is you want to know some of the easy and the quick techniques that you can use to save their lives whilst you wait for the paramedic or the doctor to come in, or before you even phone the doctor. So if you just join us, please, if you have any questions, just put them in the chat, and we'll try and go through those questions. Now let's move on to slips and falls. Now,
Mhm.
statistics shows that the most common cause of injury in the home is slips and falls, and this can cause
Yeah.
serious injury at any time.
Yeah.
Now, every year, statistics says that, especially in the UK, every year more than 4,200 children are involved in falls on the stairs,
Yeah.
and 4,000 children
Yeah.
under the age of 15 are injured falling from windows. Very spectacular. So, how do you deal with that? We haven't lost Rosie, have we? Okay, so whilst we are waiting for Rosie to come back, we've been talking about some of the easy techniques that you can use in the home to resolve some of the simple or the common accidents that happen in the home. We talked about choking. We talked about objects in the ear. We talked about head injury. We've talked about our burns. And now we're going to talk about slips and falls. Slips and falls happen to be the most common injury that happens in the home. And as I said, this is 4,000, over 4,200 children are known to be involved in accidents and that, but through falling on the stairs, especially those of us who live in story buildings, after falling on the stairs, even adults fall on the stairs. So it's important that you make note of, you are aware of what to do when you fall on the stairs, or when an adult or a child in your home falls on the stairs. 4,000 children under the age of 15 are injured falling from windows. I will particularly want to know what you need to do, what you do when a child falls from windows, because that can be really serious damage. It can be real serious damage caused to a child who falls through the window. In terms of, just to recap, whilst we wait for Rosie to come back, in terms of choking, we've talked about the fact that when a child is choking, and choking can be through anything. It can be through grapes, since there's some of the common things that we eat. It could be through nuts. It could be through popcorn. You go to the cinema, you are excited about the movie, you put popcorn in the mouth, it could be choking. So you just need to understand how to deal with some of those things. What she said that it's choking with children is that you can just put them on your lap and then you use the heel of your hand just to hit their back 5 times. And if after every 5 times you hit them, they're checking them out to see whether the object that was choking them has come back into the mouth. If it hasn't, try the second time. After the second time, if you've done it and it's still not showing any signs that the object is coming to the mouth, you've got to go straight and call 999. Someone is put in the chat, in the USA it's 911. So if you're in the USA, you call 911 so that you can then get doctors or paramedics to start approaching to see what best to do, and they will advise you on what to do. And you have to tell them specifically and exactly what you have seen and what has happened. Don't leave anything out. Don't make any assumptions. Then we talked about objects in the ear. What we said about objects in the ear is that when an object goes in the ear of the child, don't try to remove it, unless if you say it's on a park and you have something like an insect that go into the ear. You can float them out, and the way you float them out is that you pour water into the ear. So you turn the head to one side, pour water into the ear, and hopefully when you pour enough water into the ear, and it's warm water, the insect will float in the water. And when you turn the head the other way, the water comes out, and it comes out with the insect. Very, very simple. If there is no water around and the insect is going in and it's causing distress to the child, call the doctor immediately. That's very important. Or move to the nearest clinic or hospital or GP for this for care to be taken of the child or the casualty. Head injury, please, if you have a head injury, if it's a minor head injury, put the ice pack on there for 10 minutes. And then after that, whether it's if there's a fever, you give the child, or you as an adult, you can take ibuprofen, or you can then take a paracetamol or any painkiller. Rosie is back. Sleeps and falls. Statistics are stuck. 4,000 children fall through, get injured, falling out of windows. How does that happen? And what do we do about it?
Oh, so this is a tricky one. So remember, I think we touched on it earlier on. If whenever anyone falls from a height, you're worried
Yes.
about spinal injury. So um, again, I think this is even something that we do in our driving. Before you approach, is it safe to approach? If they're
Right.
falling from a height, are their shrapnel still falling? Is the building coming down? Because you, again, remember, you don't want to also end up being a casualty. That's two
Yeah.
people who are in danger. Is it safe to approach? Yes, it is. Then approach. You approach the person. Are they responsive? Can they respond to your voice? Can they
Mm.
respond to pain? Are they alert? They are in pain. You're not sure if there's a spinal injury. If you think there's a spinal injury, you're not sure if there's a spinal injury, do not move them. Leave them where they are. What you don't want to do is,
Okay. Go
sorry,
on.
what you don't want to do is let them panic as well. So keep them calm, keep them breathing, call 999. And again, hand over to them. Explain what has happened from a height. You're not sure if there's a
Okay, we seem to be going in and out. As I said at the beginning, her
you're
internet is
not sure if they've broken something. And they were
okay. It's a bit of a shame. We think we've lost Rosie again. Just to go back on some of the things that she was talking about. When the child or whoever, whether it's a child or adolescent or an adult, falls down from a height, the important thing is not to try and lift them up, especially where you suspect that there's a spinal injury. Don't force to lift them up. Rosie, are you back? No, she's not back. Okay. So some of the things that you need to check whether they are responsive, and if they are not responsive, are they breathing? You need to find out whether they are breathing. If they are breathing normally but unresponsive, you have to call 999 or 911 in the US for an ambulance and monitor their airway and breathing. Please, he says that do not move them unless you need to. If they are not breathing, call 999 and get someone or for an ambulance immediately, or someone to get a defibrillator, which is what they use to kind of work on their hearts, just to get the heart working again. Now, it's important that you leave, if the person has fallen, it's important that you leave that person in the position they are in and open their airway. So open the airway means that what you have to do is to lift your head, right? So you lift your head up like that and you use your two fingers to pull their jaw down to make sure that what that does is that it moves their forehead backwards, it tilts their head back, but then it also stops the tongue, it moves the tongue away from the back of the throat. Because you don't want a person to do is to swallow their throat, swallow their tongue, and that can lead to death as well. If you think the person may have a spinal injury, place your hands on either side of their head or your fingers on gently and lift the angle of their jaw forward and upwards without moving their head to open the airway. And if necessary, if it's a fall, then you can start CPR, which is what we call the mouth-to-mouth resuscitation. You just have to do 30 chest compressions, two breaths, 30 chest compressions, two breaths. That's what we you need to do when there is a fall. I want to see whether Rosie is back. Um, Rosie is not back. Okay, once Rosie comes back, we will talk about the final one. There are quite a few, but I think that because we're running out of time, run out of time actually. The final one to talk about will be poisoning. Poisoning, I think, is very important because a lot of the time you get people getting food poisoning or all kinds of poisoning. Now, statistics shows that in the UK, every year, approximately 150,000 people are admitted to hospital with poisoning, and it includes around 25,000 children aged under 5 every year poisoning. And most poisoning incidents involve things like medicines, household products, cosmetics around the house. So if you are a mother and you use cosmetics, be careful about what you use. Rosie, you're back. I've just moved on to. We can round up and let's talk about. I was talking about poisoning. Okay, but round up quickly on the fall, and then we can talk about poisoning, and then we can wrap
okay.
up.
Apologies, everyone. I'm really struggling
That's okay. That's
with
okay.
my internet. Thank God, this guy. Um, I think we were talking about injuries, falls. So the main thing to remember if you approach anyone as a mother, as a parent, in your home, your child has had a fall. Are they alert? Are they okay? Are they able to? If they've not gotten up by themselves, they're lying down. You can make sure that there isn't a there isn't there isn't any spinal injury. If there is you're worried about spinal injury, remember, always call 999. Keep them talking, keep them alert, engage them in conversation. Now, if at any point they become unresponsive and they stop breathing, so they're not breathing, they're not responding to you, that's when CPR, we mentioned that earlier, comes in. Now, CPR, again, is not something that I can run over in a quick minute or two, but the main basics of it is you're going to administer a certain number of chest compressions, about 30 chest compressions to 2 rescue breaths, to get to kick their heart back in, or to get the motion, to
Right.
imitate the motion of them breathing again. Again, if it's possible for you to have the training, it's a handy tool to have as a mother, not even as a healthcare professional. I encourage you all to have it. So we've run it through briefly because I'm mindful of time as well. What you do is put one hand on your forehead, you're
Yeah.
assessing the breathing, and then you want to put 2 hands on the chin and then almost tilt your head back, so it gives you a better airway, of a better view of the airway, and it also
Hmm.
lifts the tongue back on the airway to allow air entry. If they're not breathing, you can't see their stomachs, especially with kids, because when kids breathe, you can always see it with through their abdomen as well,
Abdomen.
not
Yes.
just on
Yes.
the chest. It gives you a
Yes.
good indication that they're breathing. If that's not happening, you don't need to stare for too long to see that they're not breathing. With that, then you need to consider, okay, I need to do CPR. CPR, again, is very different in children with what you do compared to adults with what you do. So again, I encourage you. There is a link that's going to be shared at the end. It's for the Resource Council. I encourage you to have a look through there, have a quick glance through, and pick up a few things.
Okay. So, well, we must apologize. This is really important. So
Mhm,
we've gone a little bit beyond our normal time. Please give us another maybe 5 minutes, and we should
mhm,
probably wrap up in 5 minutes. Two
mhm.
questions in the chat. First one is, if the child is in pain, can ibuprofen or ibuprofen or Panadol be given?
Yeah, yeah, so well, depend on the age of the child, and normally when you go to your pharmacy, again, I always say utilize your community health team. So the pharmacist will be to tell you what age is appropriate for which child, but definitely it can be given because it's an analgesic, so it's your most common and simple analgesia that you can get over the counter. So painkiller that you can get over the counter.
And the second one is that sepsis is on the rise. How do you identify it?
So I was actually going to find a picture to show you. So there is when we talk about septic six, there are things you need to look out for. So if a child is septic, one of the main things I to look out for is temperature. Have they got a high fever? So most kids that are septic will have a high fever. You also want to look out for urine output in a child. So normally in babies and kids, this morning, what is the urine output like? What is their have they not been able to open their have they not been able to have a urine output within the last 6 hours,
Hmm.
within the last 24 hours? Those are signs.
Okay. Internet has let us down. Rosie is frozen out again. I don't think we'll get a time to talk about the poisoning bit. So we would just give Rosie a few seconds. If she's back, it's fine. Otherwise, unfortunately, we would have to wrap up. Try to keep within the time. So if you've just joined us, you are a bit late because we are just about finishing the program, and we've been talking about some of the common accidents in a home and how you can deal with it. It could be accidents happening to children, babies, adolescent kids, or even to adults. And it's important that when you're in a home and something happens in the home, you have an idea of how to deal with it, because some of the actions you take, they're very early, quick and easy actions that you take early before the doctors or the paramedics come in are the ones that can save that person's life. It's very important. Please, as I said, if you have any questions, put them in the chat, or if when the program is finished, if you still have any questions, what you can do is then send the questions to us on the a business and experts forum at gmail.com, business and experts forum at gmail.com, and we will definitely come back and respond to those questions. It has been a very informative session, and I thank you very much. I can see that everybody needs that. Now, there is a suggestion about coming having a part two. We are definitely going to have a part two of this, because I think it's really important that people understand, and it's very important that you let your colleagues and friends and family come and join and listen to some of these things, because these are lifesavers in the home. You don't know when things are going to go wrong. You don't know when a child is going to fall down the stairs. You don't know when a child is going to fall out of the window. A window. Can you imagine falling out of a window? You don't know what's going to happen. You don't know when a child is going to be choking, and then you just be sitting there. You want to wait for the doctor, but maybe there's something you can do that can save that child's life before the doctor comes in. These are simple things that we can learn, quick and easy, very easy to do. You don't need any special knowledge. You don't need any special tools. You use your hands. You use water. Some of the things that you have around you just to solve some of those problems and save the lives of yourselves and the loved ones, your babies, your children. Very essential. So, we still haven't got Rosie back. We want to, whilst we're waiting for Rosie, we just want to say, I want to say thank you to you, the audience, for being there. As I keep saying every episode, without you, this program goes nowhere. But it's more important that please you let people know about this program and let them come on. It's very free. It is all it costs you is about 45 to 50 minutes every 2 weeks, and that's all it costs you. Bring your family in, come and share knowledge. What this business expert forum is about is that we educate people and businesses through knowledge sharing. Bring is free knowledge. At the beginning, I talked about this book. If you can make note of the title of the book, 1001 Home Remedies. If you can get that on eBay or Amazon, or you can get it from the bookshelf, please get it. It's very important. It has some of the you can have a lot of remedies for a lot of things, I mean, I can open this and I can tell you what I've got, how many are here. I mean, so many. Look at all of these, and they've got remedies. So you've got this page, that page, you've got another page there, you've got different top 20 top household healers, you've got special features, you've got everyday ailments, and it uses simple things like ginger, like olive oil, like tea, vinegar, yogurt. These are things that can bring healing, or things that can help with medical stuff. So Rosie is back. Rosie, I think that what we'll do is that would end here, Rosie, and then we'll
Okay.
bring you back at some point to talk about poisoning and some of the things that there's still a lot of things that we can talk about. Time will not
Yeah.
permit us to do that. So we want to say a big thank you to you, Rosie. Thank you very much. It's been really, really insightful for me. It's been really insightful, I believe, for everyone else who's out there. It's the kind of things that we need. Very informative, very useful, very helpful. A lot of us are spending time at home, so we are prone to a lot of accidents. So please share the message, get people to log on. Most importantly, please, I'll ask you to subscribe to the channel. If you haven't already subscribed to the channel, please subscribe to the channel so that when there is a new episode, you will be notified, and click on the bell so that you get notification. So thank you very much for being there as an audience. Very faithful audience. I thank you very much for being there to learn something, share knowledge with me. Your questions also help me and helps a resource person as well. We're coming. You're back again on the in 2 weeks' time. That is on the 28th of January. So please get your family ready. Um, get your friends and colleagues to tune in on the 28th at 7 p.m. It's 2 p.m. Eastern time if you are in the US. So until on the 28th, when we come away again, this is Marcus saying thanks for watching, and bye for now.